Ora inizio alla sessione scientifica vera e propria. Se vi collegate sul canale 1, quello dell'italiano, il mio sarà l'unico intervento, questo sarà l'unico intervento in inglese che faccio proprio per rispetto e cortesia per i nostri ospiti che vengono dall'Europa. It is a real pleasure and privilege to start this session for both the critical issue that will be proposed and the acknowledged opinion leaders that will intervene. Healthcare systems throughout Europe are facing the challenges resulting from an aging population, the growth in chronic diseases, burgeoning technical possibilities, and public expectations. To cope with such elements, an increasing proportion of GDP is spent on health in these countries, with increased concern about the economic sustainability of the systems and the maintainment of such standards of care. Just to provide a practical example, just consider that the pharmaceutical spending borne by the national health system for people over the age of 65 is 6 times higher compared to the average expenditure for younger individuals, and the population over the age of 65 accounts for 60% of the total pharmaceutical expenditure. We face an unprecedented pressure on public health systems, and we urgently need to identify integrated solutions to best address these challenges. A change in the current approach is necessary, therefore, if we want to flip challenges into what we should call opportunities. There are, in this scenario, 3 pressing priorities that we are required to deal with. The first one is prevention, the second, patient empowerment, and the third one is the new integrated models of care. We need to focus on the importance of prevention and lifestyles-related determinants of health. We have been saying this for many, many years, but unfortunately, what has been given to prevention as funding is very, very little compared to the needs. Non-communicable diseases were highly modifiable behavioral risk factors. Think of tobacco use, for instance, physical inactivity, unhealthy diet, and the harmful use of alcohol. They do dramatically increase the risk of and cause most of non-communicable diseases. Genomics technologies have allowed us to screen our status at molecular level. One could ask a very simple question: am I going to get sick? How bad will that be? And these are questions that can be addressed even before the individual is born. We know very well that there are 2 years of our life which are called the 2 golden years, and they are the first 2 years of life and the first 9 months of our life inside our mother. In those 2 years and 9 months, we can decide almost 70% of what our health is going to be. From the institutional viewpoint, the preservation of health requires political support, persistence, collaboration, and most importantly, a long-term vision that looks beyond short-term costs into future benefits. The evolution from the industrial age medicine to the information age health inevitably generated the shifting of power from health professionals to patients, potentially threatening the leadership of the medical profession. We cannot control the evolution of social behavior, yet we can drive and improve the relationship between patient and physician, training professionals with systematic approaches to help people, especially elderly, to lead more proactive and fulfilling lives. There should be a high-level political commitment for patient empowerment. This is extremely necessary. Unfortunately, health literacy in Europe, and so in Italy, is very low. We are below 12% of health literate people in Europe, and this is not acceptable. The reasons, then, are many. One crucial is adherence to medical plan. Strong scientific evidences concerning the compelling importance of improving adherence to medical plan in different clinical conditions, ranging from depression to hypercholesterolemia. Pharmacological treatment of this complex patient represents surely a challenge for both prescribing physician and the patient, as confirmed by the high prevalence of iatrogenic illness observed in this population, and polypharmacy, that is, many drugs given to the same patient, very frequent among the elderly, increases the risk of adverse drug reactions and poor health outcomes, discouraging medicine administration. The reasons behind this are multifactorial and complex, related to social and economic aspects, health systems and professionals, specific diseases like the cognitive impairment or depression, as well as individual patients' characteristics such as poor health literacy. Finally, new integrated models of care. While medical science innovation in the last century has advanced at a rapid pace, the health care delivery systems has stumbled in its ability to provide consistently high-quality care to all assisted people, with many unresolved arguments affecting the standardized practice of care. Main expected outcomes not predictably achieved, and wide variations in standards of healthcare delivery within and between healthcare systems. We are obliged to maintain a high-quality healthcare, but this is dependent on a range of dimensions, including the access to care, clinical effectiveness of individual patient treatment, and the appropriateness of care and relevance to the need of the whole community. But achieving quality often involves trade-offs. For example, the concentration of healthcare services can provide effective savings and specializations, but risks compromise in access both geographically and in terms of time. European countries showed scattered examples of innovative integrated models, but they are not interconnected and often not replicable in all European countries. Therefore, we very need a concerted multi-level approach to develop new policies and to produce scientific coherence, scale and intensity of actions capable of transforming the social gradient into health. The opportunity today to gather international opinion leaders, as well as policymakers and academic experts, seem to me timely and highly appropriate to examine the nature of the healthcare challenges we are facing and to draw on in the research for potential solutions. Despite our differing histories and cultural diversities, European countries feature common approaches and above all rest on the principle of social solidarity in healthcare. This, to my opinion, is the starting point and the benchmark for an efficient, inclusive and valuable healthcare systems. Well, I think that this is to kick off and to start our morning session. Minister Lorenzin will finish the first part of the session, And now I would like to ask Onorevole Gianni Pittel, Presidente del Gruppo Socialisti Democratici del Parlamento Europeo, di venire qui al podio e di portare il suo saluto.